geriatric mental health in India, the development, so the past, the present, and also my own ideas about where it should go in the future. So I'll attempt to do that. This is not a fully academic kind of presentation, but it's more like a journey of things that I've seen over the last 40 years or so. I was telling somebody I've been in NIMHANS for 40 years, and in some ways, geriatric psychiatry has kind of grown, together with my growth in the department and in psychiatry. So I will take you through that journey in the next, say, 15, 20 minutes or so. Next slide, please. So, So I've split this period of the 40 years of geriatric mental health in India into basically two phases. 20 years first, which is the early years. This is purely for convenience and also some developments that occurred. And the latter years, which is 2000 to 2020. And what is going to happen in the next couple of decades from 2020 onwards. Next, please. So in the early years, Professor CRC and Professor Monasik will remember about this ICMR task force on geriatric mental health. Under one of the earlier Director Generals of the ICMR, Dr. Ramalingaswamy, he came up with the multiple task forces on different things, community mental health, geriatric mental health, and so on. And various projects were done by task forces and also centers for advanced research. So post the task force on geriatric mental health, a couple of projects were given to Professor A. Venkobrao, who can actually be thought of as the father of geriatric psychiatry, actually, because he's really started the first geriatric clinic in the country, official one, with the support from ICMR. And these were actually three projects. One rural project, an urban project, basically to look at the prevalence of disorders among the elderly. And the other one was to see whether geriatric health care can be delivered in the public health system. So in one of the PSCs, it was converted into a geriatric clinic, and then they ran this facility. So that is where it started. And this is way back in the 80s, 80, 81, around the time that I joined psychiatry. Other seminal thing is the HelpAge India seminars, about 4 regional conferences that occurred in 1998, and the documents that came out with a whole bunch of recommendations. And I think the recommendations that were made in the HelpAge India seminars actually led the way for how geriatric mental health went on in the next, say, 20, 30 years or so. Later on, there was a report of a workshop on research and healthcare priorities in geriatric medicine and aging, which was again done by the ICMR in 1999. But after that, maybe it's time now for the ICMR to come up with another task force or another meeting on geriatric mental health, because after that, there has really not been anything in the last 20 years or so from the ICMR. The other significant thing which happened is the National Policy for Older Persons in 1999, and 99 being declared the International Year of Older Persons by the UN and the WHO. So these things, policies and also declaration by the WHO that something should get prominence, I think is very important, because what happened in 99 is that it provided a big boost to geriatric services, geriatric research, and other kinds of aspects as far as old age problems were concerned. Next, please. So in the early years, there was some exploration about the kind of problems that were there, the need, understanding mental health problems with the elderly, and there was a wide variation in mental health problems, anything from 5% to about 35% in terms of depression, in terms of psychosis, non-organic psychosis, suicide. Dr. Venkurwa wrote a lot about suicide. And all the studies found that there was a lot of close association with physical illnesses, especially the non-communicable diseases. And so even now we know that for physical illnesses in addition to a mental disorder. And that makes the burden and the treatment much more difficult. Now, some of the stalwarts in those days, epidemiological studies were in Mumbai by Dr. Vas. Other hallmark event that occurred, at least for dementia, what gave a fillip to dementia research in the country was the Alzheimer's conference, ADI conference that was organized in Cochin by Dr. Jacob Roy. Jacob Roy more or less spearheaded almost singly the Alzheimer Association in India and also the work on dementia. And this, fortunately, I happened to be there at this conference in 1998 in Cochin. In fact, I helped organize this conference because Jacob Roy was really very eager to ask NIMHANS to help. And I remember taking about 25, 30 junior residents there and helping to organize the scientific program and the newsletter and the conference. But out of that conference was born the 1066 Dementia Research Group, which was started by Professor Martin Prince, who was from the Institute of Psychiatry in London. Now, I knew Martin earlier on, and we have had various discussions, and this is really the big project that Martin did. And subsequently, for the 20 years, there have been more than 200 or 300 odd publications from the 1066 Dementia Research Network. And some of the early work and the later work was done in India itself. Now, what happened in this decade is also development of many instruments, because all of us know that for dementia evaluation, we have in the country older people who are illiterate. Many of the evaluations, especially for activities of daily living, require culture fair assessments. And so various education and culture fair assessments were done in the country. For example, the mini mental state was adapted by Mary Ganguly and her group as the Hindi mental state examination. The disability scale was as the everyday ability scale for India. The Edinburgh cognitive evaluation was adapted by Dr. Mantranath and later on Dr. Swarna Alladi to the ACE, and later on the ICMR helped translate into almost more than 10, 15 languages in India. And in NIMHANS itself, we developed a neuropsych battery, NIMHANS neuropsych battery for the elderly by Keshav and his colleagues in India, in Bangalore. Next, please. Next, please. Yeah, so the other thing that happened in these first 20 years is the birth of the geriatric mental health clinics in India. Now, I told you that one of the first things that occurred was by Venkobrao in Madurai, but subsequently, Dr. K.N. Srinivas was very interested in NIMHANS, and in 1990, I happened to be in Dr. K.N. Srinivas's unit, in Unit 2, when another faculty had moved out. And together with him, I was very fortunate to start the geriatric clinic, one afternoon clinic once a week on Saturdays, conducted by Dr. K. Srinivas, who was very interested. So we started that in 1990, and then when Dr. Srinivas retired, the clinic was closed for a short period of time, but we revived the clinic together with Srikala Varad. We revived the clinic in 1999. The other clinic that opened was in Lucknow with Dr. Tiwari, who was a very prominent geriatric psychiatrist in India. And this clinic, he took it to bigger heights because he actually started the very first geriatric psychiatry department in India, and the only geriatric psychiatry department in India. And they started their DM program actually before us, a couple of years before NIMHANS started the DM program. As all of you know, NIMHANS has a DM program and a postdoc fellowship program and many other programs that we run. Just last year, during the pandemic, just before Dr. Shaji retired in Thrissur, in the Government Medical College in Thrissur, he started the geriatric center. He got a separate building from the Thrissur, I think, operation, and we started the geriatric clinic and also geriatric bedded facility in Thrissur Medical College. And there are many medical college departments which have geriatric clinics and geriatric OPDs and wards, because one of the mandates of the Medical Council of India earlier was to have geriatric clinics. One of the things on the inspection is that we would go and check whether they have geriatric clinics. Next, please. So I'll come to the later years, which is the last couple of decades, 2000 to 2020. As all of you know, because the professionals were more and professionals who were interested were more, the Indian Psychiatric Society started a geriatric psychiatry specialty section, which was very prominent. They had conferences and CMEs which organized throughout the year. A group of professionals, psychiatrists started the Indian Association of Geriatric Mental Health, and they also started a journal, which is now a very active journal, which will soon get sort of recognized by the PubMed and other things. The Alzheimer's Association, as I mentioned, was started by Jacob Roy, and then did a lot of things. In fact, Jacob Roy went on to become the international president of the ADI, Alzheimer's Disease International. That was a very, very prestigious thing. Various other non-psychiatric societies are there. For example, the Gerontological Society of India and some other old age related societies. Other thing that I always tell people in practice is that one of the big things that made patients and their family members come to us is the availability of drugs for dementia and also availability of second generation antipsychotics and SSRIs. The reason I'm mentioning the medicines is because earlier on we were offering family caregiver programs to people with dementia and to people with depression and other elderly people with elderly problems. But family members are not very keen to come. But with the onset of medication and prescription, they were at least willing to come back and get prescriptions and engage with us. So I saw giving prescriptions as a way of engaging with family members, because they would actually come and they would actually present themselves to actually take medicines. Of course, recently we had clinical practice guidelines for geriatrics, which has been brought out by the Indian Psychiatric Society. And that is something that is, again, very useful, something on the lines of the American and the UK psychiatric guidelines for old age. Next, please. I always say that for a service to develop and a program to get prominence, you need policies, programs, and legislation from the government. And we had many of these in these 2000 onwards. We had many of these things in the country. As I mentioned, many geriatric clinics are opened up, and I can say at this point of time there are more than 200 odd geriatric clinics all over the country in many of the medical colleges. There was definitely increased funding for geriatric research, as evidenced by funding that is available from the ICMR, the DBT, and the DSC. And many of my colleagues, especially my younger colleagues, Shivkumar and Om Prakash included, did some of these initial work with the DST. There are many more training programs for health professionals. Like I said, there's a DM and postdoc fellowship program, but we also have shorter programs. And there are also formal and informal caregiver training programs for family members and also paid caregivers of people looking after these elders. Other thing that was very much necessary for advocacy and awareness, especially for the public and for the government, are these documents. A couple of documents, many documents which come out every year from the Alzheimer's Disease International, publications which come around September for the World Alzheimer's Month. The WHO came out with a couple of documents which talked about dementia being a big problem. We were fortunate to come out with the Dementia India report in 2010, which was in large way done by many of my colleagues here in NIMHANS, with support from other members of the RC. The Dementia India strategy report was sort of presented to the minister in 2018 when we had the conference in Bangalore, the Alzheimer conference in Bangalore. And very recently we came out with this Dementia in India 2020, which was almost like a sort of update on the 2010 report that was there earlier. Next, please. I told you that policies, legislations, and programs are very important, and you can see that in this last 20 years, many programs and policies have come out, which has done a great thing for geriatric care. So we had the national policy which came out in '99, but it's been redrafted in 2011. It's still not yet become a bill. We're still awaiting that. The national mental health policy was made, and then that has got, and the national health policy has got sections on old age treatment. We have the maintenance and welfare of parents and senior citizens, which is again a big thing for for family members and the courts to actually see that elders are not abused and elders get their rights and they get what they need. Of course, the Disabilities Act and the Mental Health Care Act which is part of mental health, but it also applies to a lot of geriatric care that occurs. We have programs for healthcare of the elderly. One of the things was the NPHC, which was launched in 2011. And together with that, there are programs for non-communicable diseases, the mental health program, and now with the WHO Decade for Healthy Aging, I think geriatric care will get a big fillip in terms of going forward. Next, please. Just a few words on the National Program for Healthcare of the Elderly. This is launched in about 100 districts and is being expanded currently. What is slated is there will be 20 odd regional centers with 2 national sort of aging centers in Chennai and in Delhi. And these centers are coming up. And these would essentially deliver comprehensive geriatric health care at all levels, especially at the districts. And they would actually train human resources for this purpose. The other program is the integrated program for senior citizens, which is being implemented by the Social Justice and Empowerment Ministry. And this is the maintenance of old age homes, residential homes, daycare facilities, and so on, and they give money for that. And then we have this mobile Medicare units and physiotherapy clinics, which are also maintained by that. And recently, there is the Ayushman Bharat, which is initiative, which is sort of propagated by the Prime Minister, and this is something which is which will provide insurance and other kinds of facilities for the elderly. Next, please. So, research initiatives in these 20 years. There is the WHO SAGE program, which is basically a global health program which is conducted by the WHO, and I'm very happy to say that one of our faculty, ex-faculty, Professor Somnath Chatterjee, was the PI on this project from the WHO. And there is a center centers in India, which was actually sort of managed by the International Institute of Population Studies in Mumbai. I mentioned the 1066 Dementia Research Group studies, which is again a prominent part of research that went on in dementia. Then there are various initiatives by the DST, DVT, again, things which are still going on, and there's a lot of money that has been given for this, and many of our colleagues have applied and got monies for this, for doing very good critical work. There's a WHO, we actually did the first trial of the WHO program for dementia caregivers, which is the High Support Program, which is now launched, and it's up there on the WHO website. A very significant development post this WHO SAGE was the health and retirement study, which was started in India by the IAPS, and the government of India gave a lot of money for this. They promised over 100 crore for this LASI study, and the first wave report was out early this year, and it will show a lot of striking features as far as depression, dementia, and also general healthcare is concerned. We have the 7-center Aadhaar study, which is also being done in NIMHANS by Dr. Girish and Dr. Suvarna Alladi. 7 centers anchored by the DBT and the INCLIN. And then we also have the Alzheimer's Disease International STRIDE project, which is again, we have a center in Bangalore, which is anchored by Dr. Suvarna Alladi. Next, please. Now, these are some of the awards that the geriatric services, now this is not just geriatric psychiatry, but all the geriatric work that happened in NIMHANS, both from neurology and other departments, we got this award. And I must say that I must credit Dr. Shivakumar for putting all this together and pushing it on there, because he really spent a lot of effort in collating all this and sending it up for awards. So we got 2 awards both from the national awards. And we also got a state award subsequently. Next, please. So the future. Last few slides on the future. Now, I think since we have policies, programs, and legislation in the country, the main thing is to implement these programs, policies, and legislation. And that is one of the things that does not happen very easily in India. And this happened with the Mental Health Act earlier on. So we need to push these programs and policies. Because money is available, personnel are available, it's important to make public and other people aware that this is something that can happen. There's a lot of awareness that is required from the public in terms of educating people about old age disorders, because there is ageism and people think that once you're old, you should be getting these disorders is quite normal, and then it's not. So having depression, having loneliness, having dementia is not really a normal part of aging. And we need to make people aware that they need to bring people for treatment early. So that if you treat them early, then you can see that they do not suffer as much as they would if treatment was delayed. Access to healthcare in the community is extremely important, especially for older people, because they cannot come to the busy clinic. So you must provide home-based care. And there are provisions in the NPHC to provide home-based care using community health workers or home visitors and home nurses. Telepsychiatry is a big thing that we have seen during the COVID, and I've always propagated that telepsychiatry is something that should be done in a big way for geriatrics, because you can actually reach inside the house of a person by doing this. Training of all geriatric health workers is extremely important, and there is, as I mentioned, there is money and there are programs in the NPHC, and we have done a small thing in terms of helping with this with the ECHO program which NIMHANS does, and also the IPS Indians which Suresh and Naveen helped with, and also the psychiatry program. Prevention, we know now that we can prevent many of these geriatric psychiatric disorders. You saw the Lancet Commission report which came out last year, which showed that you could actually try and prevent dementia just simply by treating the NCDs and doing some things for lifestyle modification like exercise, diet, and so on. But you can also prevent depression, for example, with exercise, yoga, and so on. You can also prevent suicide by picking up people with depression and other things earlier on. So you can actually have both primary and selective preventions for these psychogeriatric disorders. And I think the same prevention strategies that you develop for the NCDs will also work for these psychogeriatric disorders. And so we need to tell people, we need to tell physicians, we need to tell public, we need to tell family members that this is something that we must do very actively. And of course, as I mentioned earlier on, new research on epidemiology, on risk factors, on service delivery, and provisions for care, prevention of disease, and also family caregiver issues should be something that goes on. And to do all this, I think it's very, very good that we have a global action plan on the public health response to dementia. It's got various steps. I'm not going into details of that, but this is something that the WHO is pushing. And we just got another, say, 25 years or so to achieve this action plan in terms of preventing dementia. Next, please. We also have the age-friendly citizen communities program of the WHO and the UN. And this is something that in Karnataka we've been trying to propagate. Next, please. So there is future in terms of research. There is a LASI second wave that has been planned, and it's stuck now because of the COVID, but they are ready to start very soon, second wave covering many more parts of the country. And we have a LASI DAD, which is a smaller component which is looking at the dementia aspects. SANSCOG, which is anchored by Indian Institute of Science and NIMHANS, which is basically similar to an aging study in the urban and rural areas in Kola district. I mentioned the DBT Aadhaar, but that's something that's still taking off. ADI Stride. There are Indian finger trials for prevention of dementia, which is going on in different parts of the country. And now COVID-19 and elderly, which Dr. CRC is going to talk about. And many MRI, genetic and biomarker studies. Next, please. So, as I mentioned, we need to use existing health systems for the elderly. There are health programs, there are health personnel that is available. As I mentioned, there are community health workers for the NPHC, there are counselors, there are doctors, which are specifically meant for this program. And we need to make use of this, and we need to roll this out in all the districts and all the general hospitals and all the taluks of the country. Next, please. The point of entry for interventions is, if you look at the WHO pyramid of care, you'll see that the best and the cheapest and the most effective intervention is self-care through public awareness and education. So we need to push public awareness and education out there into the community and tell people what they can do to prevent mental illnesses. You need to use informal community caregivers through volunteers and ASHA workers to see that you propagate these self-care measures and propagate techniques that people can use. You need to use geriatric community health services through PHCs, health workers, counselors, and doctors. And you need to tackle these through specialized geriatric care centers, for example, the regional centers and the district centers that will soon come up, and the general hospitals. And of course, the long stay rehab facilities, the tertiary care centers, the large geriatric centers are all there for training, for extra care, and looking at very difficult problems. Next, please. Capacity building is very important, I think, for the future in terms of building capacity in the community and also in the health system. You need to do a lot of things in terms of providing health education materials, training. One of the things that you need to do is to screen people who are over the age of 45 for both NCDs and mental and neurological disorders. There are a lot of screening instruments that are available which are adapted for India. And as I mentioned, you can do all these things with teleconsultations and support to increase the kind of inroads into how we can tackle geriatric care. Next, please. So this is just a couple of graphics on the WHO Decade of Healthy Aging, which is something that you should push out there and make people aware of. Very simple things. Next, please. And this is an initiative which my colleague Dr. Shivkumar has been spearheading, Age Friendly Karnataka, where we linked up with the two ministries in the state, together with the government and all the functionaries. This is something that's going to be, and of course we have next, please. The website that Shivkumar and other colleagues of mine in the Geriatric Psychiatry unit has sort of spearheaded, Vayomanasa Sanjeevani, where we are actually broadcasting every week programs for family members, caregivers, and public. And I think this is something that's picking up, and this is something that will go a long way. I want to end here by saying thank you very much. Thank you very much to the team and to the department and the institute for having me give this talk on my journey for the last 40 years or so. Thank you very much.